And in many cases, we see that there's a lot of negative talk, self-loathing, self-hatred, self-punishment. It could be through food, it could be through relationships. But what we do really, especially if we're in that trauma actively right now, your body and your psyche, you can call it your spirit, is going to look for an active way to get out of that situation because it is not safe. Now, there are only a couple of ways to get out of an unsafe situation. First one, you run from it, right? The other one, you fight and you still run from it. And the third one, in this situation, especially when it's children and they cannot get away from trauma, their body is going to look for a way, and this will pass into our adulthood as well, to exit the trauma through shortening their lifespan. Hello and welcome to the Health Wizard podcast. I'm your host, Yelena Isolde Medici, a health and life coach. I'm so excited that you're choosing to listen to my podcast because you are choosing to make your health your priority. The Health Wizard podcast is dedicated to teaching natural, easy to implement practices that you can use to get your health on track and become the person you used to be before getting sick and the person you're dreaming of becoming again, happy, healthy, full of energy, and living a life filled with joy. Now, very quickly, before we dive into the good stuff, I want to remind you that this podcast is intended for education and entertainment purposes only. This podcast is not a substitute for professional medical advice. If you have a medical condition, please seek the help of a licensed medical professional. I am not a medical doctor. I do not treat, diagnose, prescribe, or make claims outside of my areas of expertise. So by choosing to listen to the Health Wizard podcast, you take full responsibility for your own actions. And when you hear the testimonials of the people who were able to get well, realize that their outcomes depended on their effort and their specific situation. With that said, let's jump into today's episode. Please enjoy. Hey, gorgeous people. How are you doing? I planned this podcast for a long time, and as I was getting ready to record it over the weekend, a tragedy happened. My very beautiful fur baby boy Milo was in a freak accident and we lost him. We are going through the process of grieving right now. I've had human life loss in my family before and it was deep. It was disheartening. And losing my baby who was with us for almost 2 years was actually no different. Same pain, same questions, same regrets, same tears. Coincidentally, the topic that I prepared for today was on how trauma affects our health and how trauma leads to autoimmune and thyroid and hormone imbalances and overall health issues. So at first I thought maybe let's not do it. Maybe let's take a week off. Let's not record this. And then when I put things into perspective, I think that there is no better time than now to talk about this topic. I've coached now for almost 15 years, and I worked on releasing my trauma that caused me to be sick almost 20 years ago. And here's what I found, that in the beginning of my coaching practice, at first I thought that diet cures all. And then as I began to work with more clients with different conditions from different places in this world, I found that while a healthy diet has a place in our healing process, it is only about 1/20th of what we need to do to address our health. So with years and practice and experience, I started to add things to how do I help my clients get to their 100% goal in the shortest amount of time possible. And here's what I found, that almost without a fail, women who came to me, they struggled from some kind of trauma from their past. So I went digging. I started to look if there was science, if there was proof. And now if you've known me long enough, you know that science is not an end all to everything, because science is there to observe of things that are already happening and occurring naturally. So nobody can tell me, well, what does science say about that? Because science is just simple observation and confirmation of a naturally occurring phenomenon for the most part. I'm not talking about the science that discovers new elements, although those elements already are in this universe. So the science of health It normally is there to only do one thing: observe what is happening, find out what is the best thing for a human being, and then to highlight it. Other than that, we are already doing things that we have been doing for tens of thousands of years as humans, and we don't need more confirmation than our experience. So, my usual 4 pillars of testing the truth is history, experience, common sense, and only then science. So, I really started to look at my clients, the ones that plateaued after we addressed their deficiencies, after we looked into possible genetic mutations, after we fixed the diet, and if they were still stuck, I started to look at their emotional health. Without a fail, there was either emotional, physical, psychological, or sexual trauma that we found in their past. As an example, about 5 years ago, I was working with a psychiatrist. So she is a professional in the field herself. She came to me because she had Hashimoto's, beautiful woman. She had 3 children, a husband who loved and took care of her, but she simply could barely function. So I got her in, we started to work together, and I usually expect at least 50% improvement in about 4 weeks. With her, we were at about 20% at 4 weeks. So I called her up, I said, we need to talk. We got to talking, and I said, it seems like there's so much more than what we're seeing on the surface. Can you please tell me what is going on? And I asked her pertinent questions to her past. Very interestingly, and not coincidentally, she told me that she was sexually abused as a child by her father. And all of a sudden, things made sense to me. So I gave her the tools that she needed specifically for her personality and for her situation to start releasing the trauma. Now, mind you, this is a psychiatrist who is skilled in the human mind, but in psychiatry, what we find a lot of the times they use medicine or talking to deal with something, where in some cases we need to go much deeper into releasing trauma. Some of it is physical exercises. Fast forward 4 weeks after that, and we reconnected. She was 80% better. Within 6 months, she was off thyroid medication. She lost 30 pounds of weight. All of her symptoms were gone, and she went back to practicing, seeing clients, and her husband and she reconnected on a deeper level because that trauma of sexual abuse was now addressed, and she began to assimilate it, and she started to enjoy her life a lot more. And she is not the only case, of course. Like I said, majority of my clients, we see that there's some kind of trauma in their past. So I thought that it was very interesting. So I started to compile very different methods and methodologies to help my clients to release trauma. Now, I don't do talk therapy because I'm not a therapist. And what we see is most of the times talk therapies do not work. Doesn't mean that they're not helpful somewhere. Sometimes saying things out loud, getting them off your chest is absolutely helpful. But sometimes in therapy, the therapist helps the patient to look for somebody to blame or to keep reliving the past, which is repeating trauma in the body over and over again, which is not healing. Where when you're doing coaching with me, we're looking at how to process and then assimilate the experience so that you are not pushing it down, not avoiding it, not trying to forget it, but you actually are taking the time to process what happened to you, to override the meaning that you made about yourself and about the tragedy that happened to you. And what we do is we write a new meaning and we look for the benefits. And mind you, this is hard. So imagine if somebody was sexually abused, and as we work through it, I will ask them, what can we celebrate out of that situation? On the outset, you go, Elena, you are crazy, you're evil. And I know how it might feel when I work through my trauma, and I had some. And by the way, if you want to learn about that, you can get my book, Son of a Whore, on Amazon. So it's Son of a Whore, get it on Amazon. And there I talk about my trauma and how I processed it. But when I was looking at my trauma, it took me not months, but years to finally get to the point to say, listen, I can process it, I can assimilate it, and I can find something beautiful that came out of it, so I can be grateful for the experience as opposed to wasting it altogether, which is what most of us do. We try to forget the bad, the ugly that happened to us so that we never have to face it again. Here's what happens though. The deeper the trauma and the more you're trying to avoid it, the more harmful it is in your body to you. But for me, as I did that, a beautiful thing happened. All of a sudden, and this is exactly what we're doing with our clients now, the memories of the past become not hurtful in a sense that there's regret and pain. They become a memory, but we give them a new meaning. And as that happens, the body begins to heal. And here's the mechanism. When there is a trauma in your life or severe stress, which is basically trauma as well, your body goes into fight, flight, freeze, or fawn. So 4Fs: fight, flight, freeze, or fawn states. The two are always talked about, flight or fight. The other ones people don't normally talk about. We can get stuck in them. So fight or flight, they're self-explanatory. Freeze or fawn. Freeze is when we simply feel like we cannot do anything. We are immobilized. We cannot make decisions. We sometimes don't even feel like we can leave the house. So it's very close to a panic. And you feel that the world is closed and you are immobilized by your own mind and your body. And then the fawning happens in people who are people pleasers. So if I just agree to something to get people off my back, then my life would be easier. If I just do something for them to love me, my life would be easier. That's called fawning. So when fight, flight, freeze, or fawn happen to us, what happens is that we start producing hormones of stress, and your body is stuck in this stressful situation. And when you're stuck in that situation, you're drawing on the storages of your minerals, of your nutrients in the body, of your vitamins to deal with that, because we need so much more during those times. In a normal situation, if it was just a fast exposure to something, when that event is over, you go back to normal. When deep trauma happens, such as neglect, abuse, sexual abuse, emotional abuse long-term, what happens is that you get to stay there, you live there. So your body never deregulates from stress. And that means it's constantly there, tapping into your supplies and storages of the minerals, the nutrients, of all of the things that you need for everyday regulation of hormones, such as thyroid, adrenal glands, reproductive system, and so on. When that happens, your body basically suspends all of the unnecessary, what it counts as necessary processes, and simply focuses on survival. So if you, let's imagine an acute situation, you're running away from a robber who has a gun in his hand. When you're running and you're running for your life, your body does not care about reproduction. It does not care about your thyroid or your estrogen, any of that. Your body's only goal at that point is to survive. And that means it's going to take all of its resources and throw them toward your heart beating fast enough for you to run, your lungs working so that you can breathe, and giving you the strength to get the heck out of there. Now, it would be great if you just got out of there and went back to normal, but you took the right steps to release that trauma. But most of us actually end up living our lives like this. So what happens is your body never goes back to its normal hormone regulation. The estrogen goes off, the progesterone, testosterone, things are out of whack. And there is no way out, because the medical professionals, the psychiatrists and psychologists, they're trained to do a couple of things: talk therapy or medicating you. Very few professionals go beyond that. There are some new practices and therapies that are coming out. They're not as widely used, but basically what the medical industry is set up to do to you is to make you a permanent victim, a victim of your circumstances. Now, some of you might have had some trauma and you go, well, Yelena, I'm nobody's victim. And that's fantastic. That's exactly where I live. I'm nobody's victim. But deep inside, unconsciously, unless you do all the right things or take all the right steps to release that trauma and to assimilate it, you're still going to be blaming either yourself or somebody for that tragedy happening to you. Now, I'm going to give you some examples of tragedies. I had clients who were given up as children and then neglected. Those who were verbally abused, and this could be in childhood by parents or in relationships. Women who were assaulted sexually, children who were molested, children whose parents were physically and emotionally abusive, women whose husbands, partners cheated on them. The list, of course, can go on. But it's usually this kind of deep trauma that gets stuck in our bodies. Now, we were often taught that we process things either physically, like food and our heartbeats to get us moving and going and our lungs breathing, or there's the emotional aspect of us. But where the medical science right now is failing us is for us not to realize that we don't process emotions only in our emotions. The emotions are processed by our bodies. So if the trauma happens, your every cell in your body has kind of like a little camera in there, where you want to think about that, a little brain. And that little brain has the capacity to remember. As it remembers and your old cells are shedding and new cells are created, they're basically replicating and the trauma is passed down. So it's not just your mind and your emotions that remember the trauma, it is your entire body. And right now, especially if you had any trauma in your life, you can do this simple exercise to check in with you. Close your eyes. Now make sure you're not driving. If you're driving, do not close your eyes. Take a few deep breaths, just in and out, just in through your nose and out through your mouth. In and out, just a few more times. Deep breath in and exhale. And as you're doing this, I want you to start paying attention to your body. What do you feel and where do you feel it? Do you feel a little vibration or trembling? Or if you start scanning your body from your toes and up, if you do just the right way, if there's trauma somewhere stored in your body, you're going to feel like stuck. Ooh, I got to the right place. So for example, you might be going from your toes through your knees to your solar plexus, and all of a sudden you feel like you're stuck. You can't pull the energy from there. This is one of the good ways for you to quickly check in with your body. Other indications are very simple: anxiety, panic attacks, sleeplessness, not being able to make decisions. Those are all a sign of a traumatic experience. Now, some of us might have had trauma so deep that we might have locked it up in our brains and we go, no, I never had trauma in my life. Well, if we go deep enough, for example, in early loss of your parent while you're still a child can be very traumatic. My pup, it seemed like a human dog, passed away. And that trauma is there. It is traumatic. Now, I am fortunate to know all the tools and all the things and methodologies I need to start grieving and going through this process of releasing the trauma. But if we're not careful, if we don't grieve for the loss of either innocence or the loss of loved ones in our lives, what we're going to do is we're going to create permanent state of grief that we revisit. And the more often we go there, or the deeper we lock it up, the more we stay there. So the goal is always to acknowledge that, yes, I do have trauma. And if you had simply forgotten it, sometimes just going into either a breathing exercise or meditation and relaxing your body, shutting off your mind from the chit-chat, from that constant conversation that is going on in your head, and focusing on your breath and on your body can allow some of the old memories to float up to the surface. Now, some of you might be listening to this and saying, oh my God, I never heard of this, but yes, there was a lot of trauma in my life. And you can actually go ahead and name off what the trauma was. So grab your pen and paper. It's actually very therapeutic when you're going through this process to write things down, because there is an actual release of trauma through processing emotions through writing. But the first step to realizing that we need to heal is by acknowledging there was trauma. Now, quickly back a little bit here to talk about how does the process happen of you getting an autoimmune condition or a thyroid or a hormone problem. I already explained a lot of this, that when you're in this fight, flight, freeze, or fawn mode, your body is not focusing on running the house as smoothly as possible. Your beautiful body. It simply is focused on survival. By neglect, and sometimes what we do also is when we are traumatized, we seek comfort in either food or medication. Some people go to drugs or alcohol. Through this process of either neglect or trying to actively cope with the trauma, we are making this process even worse. So let's say your diet is perfect, but you still have a lot of trauma in you and it's not released. It's sitting there and now it's undermining all of your efforts. And it is also causing you not to sleep as well. And when you're not sleeping well, then you're more likely to keep gaining weight or just not lose weight. Or for some people, they will lose weight and too much of it. And if you're not eating well, now you're coping through overeating, undereating. We sometimes eat for comfort, and that's an eating disorder of itself. And we do that in order to avoid the traumatic experience or dealing with it or the memories. Now, in certain situations, especially, I found that in psychological kind of trauma or the sexual trauma that happens to young women and men and children, is that we see that they end up blaming themselves. So, for example, in a case of sexual trauma, a child might end up saying, or a woman, it was my fault. What did I do wrong? Or some women, we've seen beautiful women, they suffer and they go, oh, it's because I look good. So they start loathing their body, or because something traumatic happened to their bodies, they start disassociating from the body because it happened to the body and I want to get away from it. And in many cases, we see that there's a lot of negative talk, self-loathing, self-hatred, self-punishment. It could be through food, it could be through relationships. But what we do really, especially if we're in that trauma actively right now, your body and your psyche, you can call it your spirit, is going to look for an active way to get out of that situation because it is not safe. Now, there are only a couple of ways to get out of an unsafe situation. First one, you run from it, right? The other one, you fight and you still run from it. And the third one, in this situation, especially when it's children and they cannot get away from trauma, their body is going to look for a way, and this will pass into our adulthood as well, to exit the trauma through shortening their lifespan. So this is unconscious self-suicide. I know it sounds a little dramatic, doesn't it? What is self-suicide? It is when your psyche, when your emotions, when your heart, your spirit, your body, they want to get out of something and they don't know how to. The body starts killing itself. I know you might want to take a moment here to breathe. What, right? I've been working on writing my book for a few years, and this is going to be one of the big chapters that I dedicate to self-suicide. But we all do it. It's not safe, but because I'm frozen and I cannot get out, what do? I get sick. In one of Joe Dispenza's books, he talks about a woman that came to one of his meetings and she had brittle bone disease. And as they were working through it, she was in a collective setting. He does not do one-on-one work. But when she got well, she told him the story of what really happened. When she was young, she was sexually abused by her stepfather. Now, a child cannot protect herself in that moment, and she looks subconsciously, unconsciously how to get away from it. So her body created this illness because she was not born with it. And because she was almost impossible to touch without being broken, she had brittle bone disease. This was her way of protecting herself from an abuser. And as long as she was sick, nobody was touching her. Now, with time, as she got older, she moved out. She was on her own, but her body was still in the cycle of self-preservation. And only through the work of releasing and assimilating the trauma and letting it go was she able to heal, up until the point when she was ready to empty herself of that trauma and give up that self-protective mechanism. She was sick no matter what she tried. And for some of you, this might be the case. You've tried a lot of programs and supplements and medications, and you tried changing diets, and you go, it's not budging, Elena, no matter what I do. Well, dear friend, if there is trauma in your life that has not been resolved, that you simply don't know how to dig into and process, it will be that trauma that is making you sick. What happens the longer we have that trauma is the body will attack itself. So for example, if your constant conversation with you is you're fat, you're ugly, you're loathsome, nobody loves you, you're punished for a reason, and you make the stories whatever to justify the abuser. As you continue to attack yourself emotionally through your thought, your body will reciprocate and duplicate what you're doing physically. So you're looking in a mirror, or maybe you're even afraid to look in a mirror at yourself, and you're despising yourself, you're criticizing yourself. Eventually, your body will duplicate what you're doing. It will start hating itself. It will start attacking itself. You're probably thinking, Elena, it sounds like almost unreal. Of course it does, because modern medicine taught you that your body is separate from your emotions. And nothing, absolutely nothing can be further from the truth. I know that between the medical science that teaches us that our bodies are just machines and religions that teach us that it's nothing but a house that we live in, we had learned to become disassociated from the body. Yet, especially in the Western culture, we're so obsessed with our bodies and the beauty. So there's a complete imbalance because nobody teaches us that our bodies is our human experience of our spirit, of our heart. I believe that our energy, now I'm a physicist by training. In physics, we know that we cannot add or subtract from the energy that is available in the universe. It simply shifts its form. So let's say my beautiful baby boy, Milo, he died. His body is in the ground. His essence is somewhere else. But the amount of that energy is still the same. It just shifted into a different form. The same happens with us humans. So by extension, when we're here in these bodies, it is our spiritual journey through a physical experience. It's kind of like dialing in a radio. For those of you who are old enough to actually have radios with dials, until you hit the right station and you hear the music. When you dial out of that station, it doesn't make the station disappear. You're simply on a different wavelength. So in our bodies, it's exactly the same. Right now, we're tuned into this specific experience that is called, in my case, Yelena. In my pup's case, it was Milo. For my husband, my daughter, it is who they are. For you, it is who you are. But the moment we're done on this planet with our life experience, we simply tune out, the body drops off, but we continue on. And you don't have to be religious to believe this. I would not call myself a religious person. So this comes from a point of science. Now, as a physicist who also loves quantum physics, there's a lot of conversation about parallel universes right now. So we can dive into that at a different point. For this life that we have in these bodies, what will suffice for us to know is our bodies are not separate from us. Our bodies, when we go through trauma, are the very spiritual, emotional being that we are, that keeps the memory of that trauma. And unless we release it, no matter how horrible or painful that situation was, unless we go through releasing that trauma, we can never truly heal. Somewhere underneath the surface, despite the medicine and the surgeries and the supplements and the treatments you get, there will always be a residual problem, just awaiting the right moment to come out to the surface. And mind you, your body will get your attention. So if you're not working right now actively on resolving and assimilating your trauma, one of the ways that your body is getting your attention is by getting sick. It simply says, pay attention. Unfortunately, again, most of us are trained to start looking to doctors and surgeons as opposed to the experience that we went through. So we get lost in the pursuit of health, but in all the wrong directions. Now, like I said many times before, if you heard my podcast before, I believe that in acute situations, we absolutely need doctors. We might need medicine. In chronic situations, they are useless. So the first thing that I do with my clients when they become my clients is I have them tell me the full story of their life from the moment of their conception, and sometimes before we actually dig into family history, because trauma can be passed down through generations. Here's a little piece of information for you. And this is scientific, so you can take it to the bank. But when your mother was in utero inside of your grandmother, she already at a certain age of development had all the eggs that she would ever have, which one of them was you. And those eggs were programmed with the emotions and the experiences the way she was experiencing that inside of her mother's womb, which means whatever the mother, which would be your grandmother, was going through, your mother was going through, and you as the egg who is going to become a human were going through. And this can be taken generationally for generations past, your great-great-great-grandmother, and so on and so forth until it got to you. So you have a collective life experience. It's not that you just got their physiological DNA that might be predisposing you to illnesses or certain characteristics or eye color or hair color. You actually inherited some of their trauma and life experiences. That's why some of us are born more resilient and some of us are not. For example, my parents went through World War II and the Great Depression. Their parents went through even much more because they had to survive. By the time I was born, I already had those survival skills built into me. I'm very, very good in crisis. I know exactly what to do, when to get food if we need food, where to get extra money, and so on and so forth. I am wired for survival, of course, not to lose the attention and the fact that I grew up under communism, and that really taught me a lot of lessons on self-survival. So going back to what we do is we go to your life experiences from the time of your conception and before. Then we go through your life to understand your characteristic. I actually have my clients take a personality test. I have conversations with you to understand you. I listen to your words. For example, I had a client who, when I spoke with her, would use words such, "Oh, this is just so hard." Now, for any other person, you'd be like, "Well, it's hard." That's what she meant. For me, I'm also a great empath, and I do a lot of my coaching intuitively. I said, "Okay, well, tell me a little bit more about why is it so hard?" And as she expanded on it, I said, "Okay, well, still not the root cause. Tell me, when was the first time that you felt that your life was hard?" What amazed her and me was that she actually could remember the time when she first said, "My life is so hard." She had very hard childhood. She had to become a parent to her siblings, and she had a really strained relationship with her parents. And at one point, as she was not yet a teenager, she said, "It is just so hard." And that stayed with her. So one of the ways to deprogram that trauma from her life was to change her vocabulary, but it would have been impossible to do until we understood the trigger event. So what we do is I listen to you as when you come to me, and I hear your words and I hear your story. And through that and understanding your personality, then I create a protocol that would be specific to you, whether you need a physiological exercise to release trauma, or an emotional exercise, or going and releasing that trauma through specific breathing techniques. And I have multiple techniques. What I find amazing is that people who are willing and open to work through that and are willing to become the captains and the creators of their own fate, they heal the fastest. So you can keep hopping from doctor to doctor, taking more medications, more supplements, doing more protocols. But if you heard me really, like at your core, what I said today, if you had trauma in your life, or if you're living through it right now and it is unresolved, my dear friend, one day you're going to hit a plateau in your healing, even if you get any. And you won't be able to heal beyond your ability to heal that trauma. So the big questions are always, of course, Yelena, how do I release it? I believe that trauma release should be as unique as you are. None of my clients have an identical protocol that I create for them. You actually need a method that will match your personality, will match your life view. I work with people who are Christians, who are Muslims, who are atheists, and we need to customize it that it will go along with your life's philosophy, along with your faith and your ability to surrender to the process. So there is not a one-size-fits-all approach, but the first place you start is figuring out where the trauma happened. Second piece that you can do for yourself is write down the story that you created about yourself in that situation and because of it, the meaning that you gave it. So for example, you might have been rejected by your parents, and the meaning that you give to yourself now is that I am not lovable. I am hard to be with. I am fill in the blank. And oftentimes what you actually will find is those words are what your parents or the people in your life, people in authority, told you. But now you're repeating them, but only in your voice. And that's what makes the trauma even harder, because you are giving them voice to whoever the abuser was continuously in your life, and they're staying there. So first of all, identify the trauma. Second, make a list. So write it all out about the meaning that you made about the world, the relationships, and yourself through that process. Thirdly, what you're going to do is you're going to identify the language that you're using about yourself and the meaning that you're giving about your life through that language about your life and about what's possible and impossible. For example, you might have been suffering with hypothyroidism for a long time. No matter what you try, is not helping, not working. And so your story might have become that it doesn't matter what I do, nothing will work ever. I had a client one time that she came to me after trying to heal herself for a few years. And she said, Elaine, I tried every program out there. So she still decided to work with me. In the first few months we're working, and she's not getting better. And then as we're working through these emotions, she had an aha moment. She actually drew pleasure. And this would be a conversation for another podcast, but she drew pleasure from checking off her symptoms every single week and sending them in. And it was her way of showing it. See, I'm not fixable. I'm really as broken as I was told. When she finally had that aha moment, and it was a beautiful aha moment, and she was willing to let it go, which she did within the 3 months after that, we got her close to 100% wellness. Now the difference was simply by acknowledging that she was a participant in the trauma that somebody else inflicted on her. So if you find yourself in the same situation, you need to start paying attention to the internal conversation that you're having with yourself. Your internal conversation toward yourself and toward others is the greatest indicator of whether you will ever heal or not. So that's the step 1, 2, and 3. The fourth one, you really need somebody who is as good at releasing that trauma with others as you want it to be for yourself. When you try to do something on your own, it usually fails. And here's why. It's not because you're not brilliant, because you probably are, because you're listening to this podcast, but because we are short-sighted. We do not see the possible pitfalls. We don't sometimes see where to go, how far to go in our trauma release, because we lived in that trauma for so long. We're programmed with it so deeply that we cannot get ourselves out. It's kind of like if you fall into a very deep ditch, you will not be able to climb out of it no matter how hard you try. You need somebody to come with a rope or a ladder to get you out of there, to pull you up, to clean you off, to provide you with comfort and provide you with love, and then you will be able to go on your own. In America, we're so much DIYers. I'm going to do it myself. I don't want to pay anyone to work with them, which is, of course, your prerogative. But we sometimes get stuck in this cycle, like blind leading the blind. A person who is hurt is trying to heal him or herself without outside help is becoming a vicious cycle. And it's as ridiculous as somebody with a brain tumor trying to operate on himself. It simply does not work. In cases like these, that the ones I described, if you find yourself there, that there is trauma, or you simply don't know if there was trauma and how to uncover it, you need a professional to guide you through. And it will be worth every single penny that you spend on them. Now, it can be me, it can be somebody else. It's totally up to you who you choose to work with. But when you look for that somebody, make sure that they have a personal expertise in releasing trauma, so it's not just theoretical for them. Then they have professional experience, because they need to have help others. You should not be their trial case. And then you want to see if what they're doing is logical, common sense, if it's proven to work, and of course, if it's going to last a long time. So the big idea here is you can right now take your first step into identifying the trauma, into identifying how it's affecting you, and then making the decision about what you want to do with it next. Do you try to do it on your own? Do you keep coping with it and pushing it down? Or do you reach out to somebody like me and say, I need help, get me there now? The decision is totally yours. And I want you to simply know that because we now know that trauma is a huge contributor to autoimmune conditions, to thyroid and hormone conditions, and many other health conditions, we also know that when we release it and address it and assimilate it and find wins in that trauma, we're also able to reverse those conditions. Now, of course, trauma is not the only contributing factor to health conditions. I would be amiss if I said, well, let's fix trauma, and that would be it. That was like me earlier in my coaching practice when I thought a great diet heals all. It would be too short-sighted. I look at over 18 factors, over 18 possible root causes of what is making somebody sick. But trauma happens to be one of the very deep and common ones. And even if you feel like you never had trauma in your life, which is almost impossible, by the age of 40, all of us had some kind of trauma. If you ever went through any deep experience of severe stress, that is a traumatic experience on your body, and your body always will keep the score until you will give it the tools to climb out of that ditch of trauma once and for all. Well, that is it for me right now, dear friend. I'm still working on releasing my latest trauma, which was losing my baby boy. And because I have already the tools that I need to release that trauma, I am first doing this. I'm going through the grieving process. And the first week and the first few weeks are usually the hardest. And then we start addressing it through memories, being around people who love us, doing the breathing exercises my clients do and I teach them to do, and sometimes simply sitting in gratitude for the things that happened to us, no matter how horrible it might have seemed. In my case, I remember about all the beautiful times that I had with my boy. And I look through those pictures and I look through those videos, and yes, I cry. But I find comfort in seeing him again. Now, your traumatic experience could have been different. I had different kind of trauma that was in my past. Again, you can find it in the book called Son of a Whore. But I dealt with it and I moved on from it. And I was able to heal myself 15 years ago. And I've been healthy ever since. And when I have the tools that you can now also have if you reach out and we end up working together, I can use those tools for the rest of my life to never fall sick again. So I hope that this podcast is going to open your eyes to something that nobody did for you before and give you one more thing, one more tool to get closer to your healing. And if it happens that you are ready, you're absolutely ready to say, Elena, I need somebody to come alongside me and help me, simply reach out. Go to www.360impacthealth.com/schedule. Again, it's www.360impacthealth.com/schedule and grab a complimentary 15-minute call with me to see what is possible for you. In those 15 minutes, I'll ask you 11 questions to see what's happening with you, why things are working or not working. I will look at your goals. I will look at your personality, and I will see if your case can be solved by my skills and if I want to work with you. If the answer is yes, we're going to take you to a longer conversation where you will be able to ask me questions as well. This is how simple it is. Right now, we're boasting a 95, 98, and sometimes higher % success rate with our clients. That means if I say yes to you and you say yes to your health, then there's an over 95% chance that you're going to get exactly the health that you are hoping for. Have a fantastic rest of the day, my wonderful friend. I will talk to you on the next episode of the Health Wizard podcast. In the meantime, if you enjoyed what you heard today, please do me a favor and go ahead and leave a podcast review on wherever your podcasting platform is, Apple or Google or wherever it is, because the more 5-star ratings we get, the higher the platform will bump us to be searchable, the more people we can help. So will you do that, please? And thank you so much in advance. There you have it. I hope you enjoyed today's topic. If you did, make sure to subscribe to the Health Wizard podcast. And please don't forget to tell others about it. If you would like to get more information about me and what I do, how I help amazing human beings just like you to achieve their dream health, go to www.360impacthealth.com. Go to the contact page and shoot me a note. Thank you so much for listening. I'll catch you on the next episode of the Health Wizard podcast. This is your host, Yelena, wishing you optimal natural health.